Hello, my name is Annalie Martin, and today I will be speaking with you about collecting a midstream urine specimen and collecting a urine specimen from an indwelling urinary catheter. So sometimes the collecting a midstream urine specimen is also referred to as a clean catch sample because it does it more closely shows like characteristics of the urine that are made by the body. With every sample, it usually will have the time and the patient's ID number, which you will definitely want to check with their bracelet. And then you will need to write in the time, the route, and you're going to want to put your own initials on there. That is very important because otherwise, if it gets to the lab and it doesn't have that, then they're not going to know what to do with it. So that is very important. So you are definitely going to want to take the time to educate the patient here because they do need to take the proper steps when doing this procedure. If they are able to do it by themselves, you would want to instruct them how to clean the area properly. If they're a male and they have foreskin, they're going to want to pull that back, and they're going to want to start at the top, at the tip in a circular motion and work their way down. Also, if it is a female, you're going to want to give them a wipe, and you will want them to clean themselves thoroughly as well. Just like we learned, like in the bed bath, you're going to want to make sure to get both sides and the center, and always work from front to back. You're going to want them to either start peeing and then stop and finish and get that into the cup, or they may also be, if it's sometimes with males, it's harder to stop. So sometimes for them, it's easier to just like put the cup in midstream. And they are going to want to make sure that they set that lid with the top on the counter, and you're going to want to make sure that they don't touch the inside and that they put the cap on. When you get it back, you're going to want to make sure that the cap is on tightly. You are going to want to make sure that is very secure, and you are going to want to make sure that it's labeled and put that in the biohazard bag. You are going to want to make sure that you document. So you're going to want to document the odor, color, and clarity of the urine as well. And you will also, I think I did already say, you're going to want to make sure you document the route as well. So with that, and then of course you would perform your hand hygiene and get that off to the lab as soon as possible. So collecting a urine specimen from a indwelling catheter is a little bit different. They do have that has the tubing. So you will definitely want to take some make sure that you're careful with the tubing. You are going to want to make sure you have everything that you need at the bedside, and you are going to want to label the container just like you did the mainstream urine with the time, route, and also you're going to want to make sure to put your initials. You're going to want to put on your gloves, make sure that the bed is at a working height for the patient, and then you are going to want to again, make sure that you put your pad underneath. And then you are also going to want to put a pad under the catheter as well, just to make sure that nothing happens there. So the next thing you're going to want to do is you are going to want to clean the access port with the alcohol pad, you are going to want to then you're going to want to clamp the tubing, and in the video they just put like a band over it to keep it clamped, so that will stop the flow, and then when you do sterilize it with the alcohol wipe, you are going to want it to let it air dry. So next you will take the syringe and you will put it in the access port. Make sure that it's all the way shut so that you know, nothing like leaks out. And then you are going to want to aspirate at least 10 milliliters. And then you will remove the syringe and make sure you cap that back up. And then you will inject it into the container. You will then want to put the lid on, and you will want to dispose of that syringe, and then you will remove the clamp, and you'll want to make sure to straighten that out. Just make sure that there is no kinks, and then again, you're going to document just like the mainstream urine specimen, and make sure that you document all of your findings. Thank you.